Hey everybody, just a couple quick tips for all of you aspiring pharmacy technicians out there. There's a specific branch of pharmacology called pharmacokinetics, and this branch of pharmacology describes what happens to the drug as it takes its journey through the body. So most people think when they take a medication that the important thing to know is what the medication does to the body, the good effects it produces, the bad effects or adverse effects. But just as important is what the body does to the drug throughout that process. And a helpful way to understand this is through the acronym ADME or ADME. So A stands for absorption, which describes how the drug is absorbed into the bloodstream or the circulation. This is especially relevant for medications that we take by mouth, because as that medication moves through the gastrointestinal tract, it will be absorbed into the bloodstream, where it's probably going to exert its therapeutic effects. Which brings us to D, or distribution, which describes how extensively that drug is sent to all the tissues and organs in the body. Some drugs maintain most of their concentration in the bloodstream, whereas other drugs may be more extensively distributed to different tissues. Next is M, which stands for metabolism. So this describes the process in which the drug is broken down in the body into various substances. So you've got a drug that's got an active ingredient molecule, and there's going to be different enzymes in the body that help catalyze reactions that break that drug down into other substances. And we call those other substances metabolites. And interestingly, those metabolites can have therapeutic effects and side effects as well. So it's very interesting to understand that. It helps us understand the potential for drug interactions, the potential for side effects in patients that don't eliminate those metabolites that well, etc. And then lastly, E, we have excretion or elimination. So this describes how the drug is removed from the body. And this typically happens through the urine. So drugs are excreted through the kidneys and out of the urine, or sometimes through the GI tract and out in the feces. And in rare circumstances, drugs can even be destroyed within the body, in the bloodstream. So that describes the drug's journey, ADME. We have a lot of information about how that's relevant to understanding how drugs work and what happens to drugs. Just a helpful tip to start your day.